This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. As the season changes and the weather gets colder, Connecticut residents are wondering, will there be another surge in COVID-19 cases? Coming up, we'll talk about that with Yale Public Health Professor Albert Ko, who was co-chair of the Reopen Connecticut Advisory Group and who continues to serve as an advisor to Governor Ned Lamont on Connecticut's response to COVID-19. We'll also hear from Stamford Mayor David Martin about how his city is working to contain outbreaks. One tool that's helping public health officials respond quickly to cases is not what you might expect us to talk about on a morning talk show, and that's poop. A team of researchers at Yale University has been testing wastewater for COVID in New Haven since March. A study about this testing program was published in the journal Nature Biotechnology just last week. Joining us now on Zoom to talk about it is Jordan Peccia, professor of environmental engineering at Yale University. Jordan, welcome to our show.
Good morning, Lucy. It's a pleasure to speak with you.
Also with us on Zoom again is Dr. Albert Ko, department chair and professor of epidemiology at Yale School of Public Health. Dr. Ko, welcome back to the show.
Thank you very much, Lucy.
And listeners, you can join as well, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Jordan, explain how this all works. So if somebody has coronavirus, how much of the viral particles do they shed in their waste?
Well, coronavirus is a respiratory virus, but it belongs to a class of pathogens that can infect different types of tissues in the human body. Coronavirus not only can affect our lungs, but it can be present in the human gut. And that means when we use a toilet and we flush the toilet, it goes into our sewer systems and then all collects at a wastewater treatment plant. If we can sample the wastewater treatment plant, then we can get a composite sample of all the people that are served by that treatment plant. In New Haven, that's 200,000 people.
This idea of looking at sewage is not a new idea. Can you talk about how it's been used before to look at other diseases?
The main usage has been for polio. And there are many differences certainly between polio and COVID, but one similarity is that when a person is infected with polio, it is more of a rare situation that they would see paralysis type symptoms. More commonly, they can be either asymptomatic, have very light symptoms, or have symptoms that are not indicative of paralysis. And so that disease can go undetected. And in many parts of the developing world where polio still exists, the best way researchers in the World Health Organization have found to observe polio and survey it is by using wastewater, to sample wastewater in sewer systems in large cities, or even in drainage ditches where sewage from small villages or cities with unimproved wastewater systems drain into. That way they can sample that and they can see if there's an outbreak or even if polio might exist in that community.
I mentioned that you and your team started testing wastewater in the New Haven area back in March. So can you break it down for us? How does this work? What exactly are you testing and how do you get the samples?
Well, we test something called primary sludge. And while everyone might not be familiar with the exact workings of a wastewater treatment plant, it's at the beginning of the plant and it's called the headworks. When the wastewater comes in, it's a mixture of water and what engineers call solids. Those solids go into a large tank where the flow slows down and it gives time for those solids to settle to the bottom. When they settle to the bottom, that's called primary sludge. And we have folks at the treatment facilities that we're working with sample 40 milliliters of that primary sludge each day. We take it to our lab. We extract all of the RNA from that primary sludge, and then we use very sensitive techniques. In fact, the same techniques, quantitative reverse transcriptase PCR, that are used in individual COVID testing to determine the concentration of SARS-CoV-2 RNA in the wastewater.
When you talk about individual testing, you're talking about the nasal swab test?
That's right. Yeah. So we use exactly the same test. In fact, part of our protocol lists the CDC protocol for testing nasal swabs.
You also talked about extracting the RNA. Can you explain that for us?
Yeah, that's the difficult part of it. And so what you have to take is something that's a pretty unpleasant sample. And you have to extract that down into something like 51 millionths of a liter. And that has to be pure, clean RNA. So the virus is an RNA virus. It doesn't have DNA. It just only has single-stranded RNA. And if we can extract that type of RNA from the system, we know the specific sequences that are unique to that virus. If we can identify those and quantify those, that's how we get the concentration of the virus through all that other mess in the wastewater treatment plant.
And as far as timing, Jordan, if someone uses the toilet in New Haven and they flush, how soon do those solids end up in this sludge that then is being tested?
Yeah, it depends on a few things, but like how close you are to the treatment plant. But in general, we think of 2 to 4 hours between the flush and it showing up in a treatment plant. It takes another couple hours to make it through that primary sludge treatment. And so, I would say 10 to 15 hours is a good number from the time that a person might flush to the time that it would show up in our sample.
You're hearing Jordan Peccia here on Where We Live. He's professor of environmental engineering at Yale University. He's been leading a team of researchers who've been analyzing wastewater data from the New Haven area to detect positive COVID cases and to help public health officials when we think about possible outbreaks. What have you learned from this data, Jordan?
Well, we learned a few surprising things. The first thing that was surprising, at least to me personally, was that when we started sampling in New Haven, we sampled in March 19th, and the initial outbreak wave was just getting underway. It peaked in around mid-April, and then slowly came back down to sort of minimum levels in the summertime. When you look at the actual cases per day, the type of data that we're all used to looking at on the DPH website or in the New York Times, you see that outbreak curve. Well, the wastewater concentrations follow that curve very closely. But there was one specific difference in that, and that is that we were able to see the wastewater peak and to rise and then go down on average about 7 days before the data before the data shows if you were looking at cases. And so it gives us some lead time into that. Now, there's different ways of looking at cases, but if you just look at the way that the cases are reported out to the public, we were about 7 days in front of that.
Wow. Dr. Albert Coe, I wanted to bring you into the conversation. Tell us more about, from the public health perspective, when we hear Jordan talking about this 7-day advance notice of the virus being in the wastewater and how that can help public health officials.
Yeah, Lucy. So again, thank you very much for the invitation to participate today, and also with my colleague, Jordan. And really to highlight, this is really an excellent example of innovating thinking, coming out of the state in response to the COVID outbreak. We've had a long history of identifying pathogens, whether they're in food, whether in water. Legionella is a good example. I think and the work that Jordan and his team has done has really brought this in response to the epidemic. And as Jordan mentioned, this is kind of the smoking gun, or the proverbial smoking gun. They found with using a very sensitive and specific assay, this virus, in sludge, in sewage. And there's only one way it can get there, and that's by people being infected. We don't have, for the most part, humans are the primary carriers of this virus. So there's really no other way that it can get there. And as Jordan also outlined, with the New Haven experience, we know that as the epidemic grows, this, you can detect increasing amounts of the virus. And as it goes down, you detect decreasing amounts. I think the key question and really what Jordan was saying is about that lead time. When we were hit hard by that, the first, wave or first surge, back in March and April, we had, we were relying on metrics, or indicators that were what we call lagging indicators. These are hospitalizations and these are deaths. And these occur, probably community-wide transmission occurred, 2, 3, 4, maybe up to 5 or 6 weeks prior to us detecting signal in the hospitals when cases in. And so what's really exciting about this is the ability to identify, outbreaks and transmission clusters, ahead of time. I think one of the key questions is how long, and Jordan, I had experience from New Haven, is about 7 days. And, the big question is that going to be the case in all cities? And also how much of the increase corresponds to how much transmission, how many cases that we're going to be possibly seeing in the future. And that's exactly what Jordan, working with the Department of Public Health, the governor's office, is doing through several cities in New Haven. So this is a potentially, has really high potential value to helping really the surveillance and really the response to COVID and doing it ahead of the curve.
Jordan, Peccia, I guess another benefit to this wastewater data when we think about this particular virus, not everyone who has it has symptoms. And so this is another way, when someone doesn't have symptoms, they're not going to get tested in the traditional way. So another way for public health officials to understand how the virus may be spreading in the community.
Yeah, that's right. That's one great example. And there are many others. This does give you an independent approach to testing, to looking at least overall quantities of virus in the community. And so to the extent that there are many things that we don't know, like how many asymptomatic carriers there are, or outbreaks or community spread that somehow goes undocumented, we'll still see that in the wastewater.
When you were seeing some of the peaks in New Haven earlier, a few months ago, Jordan, how did you and your team communicate with New Haven officials, and how did they respond?
I'd say that we communicate well with New Haven officials right now. Early on, we started this just trying to work out, whether we could do this or not. And so we communicated initially with the wastewater treatment facility. And as the data started coming in, that's when the director of health and the mayor in New Haven and the city's epidemiologist started to become interested in this. And so we communicate with them at least a couple times a week, reporting what we saw in the wastewater, letting them know if there's something that seems concerning, and trying to give them a heads up. So, we send them the data. And right now we communicate with them at least once weekly or as needed, depending on what we see in the data. And indeed, for all of the cities that we're working with now, we try to keep a careful communication open between our group and the cities and the state as well, just to make sure that, they know exactly what's going on as soon as we know what's going on.
So, Jordan, tell us how many cities are now using this wastewater testing program?
There are 6 metropolitan areas, we'd call them, that are using this wastewater treatment program, and that corresponds to 7 wastewater treatment plants. And so in Connecticut, as well as many other states, often different cities will share a treatment plant. And so the city number is much more than 7. The major areas that we're sampling are in Hartford, they're in Bridgeport, which are 2 plants, there's Stamford, New Haven, Norwich, and New London.
And these are densely populated areas, Dr. Albert Coe. We know that in cities, especially when people are living in close proximity, there are people that are vulnerable in these communities. Another reason why this is important to have in our cities, this type of surveillance program?
Yeah, no, you're absolutely right, Lucy, that, this is a virus that, because of its transmitted person to person, places where you have a lot of social contacts, people coming in within, whether it's 6 feet or so of each other, it can be passed by respiratory droplets. So that, certainly is, makes our densely populated, crowded urban centers a setup for increased transmission burden. The other reason is, as you mentioned before, that, our cities have large proportions of vulnerable populations. And these are populations that don't necessarily have access, the best access to healthcare and to getting tested by COVID. And as Jordan mentioned before, roughly half the people who get COVID, don't ever develop symptoms or don't know that they've been infected. And so this is a potential mechanism to really detect transmission in places where we have populations that don't have access or have reduced or limited access to testing. And so we can get, again, ahead of the curve and a jump start on how to address these outbreaks.
You're hearing Albert Coe here on Where We Live. He's department chair and professor of epidemiology at Yale School of Public Health. He also serves as an advisor to Governor Lamont on Connecticut's COVID-19 response. Also with us is Jordan Peccia, professor of environmental engineering at Yale University, as we continue to talk about this wastewater testing program to help public health officials contain potential outbreaks. We're going to hear from one of the cities that's participating in this program right after the break. You can join us too if you have a question about this type of testing or worried about a potential surge in the winter. We're here to help answer your questions. The number 888-720-9677. That's 888-720-WNPR. And you can find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Earlier this month, the Stamford Advocate reported that City Mayor David Martin sent out an emergency message warning residents the city likely is set for an increase in coronavirus cases. How did he know? The virus was detected in feces from city residents at the local wastewater treatment plant. Now, Stamford is among the cities participating in Yale's COVID-19 wastewater testing program. Mayor David Martin joins us now on Zoom. Mayor Martin, welcome back to the show.
Good morning.
Our listeners can also join at 888-720-9677, especially if you have a question about the next few months. You can also find us on Facebook and Twitter at Where We Live. So, Mayor Martin, when we talk about this wastewater testing program, we heard earlier about how it can really serve as an early warning system. So tell me about how you're using this data in Stamford.
Well, it's exactly that. To give you a context, we believe that Stamford, being very close to New York City and with a very diverse, economically challenged population in some cases and high density housing, we consider we were the epicenter of risk. We went from one case, our first case on March 11th, and that person actually was not patient zero in Stamford because they came from out of town and went directly to the hospital, never had any contact with anybody here. We had 1,000 cases within 4 weeks. And I had been looking, I in fact told my director of public safety and my health director, I'm looking for an early warning indicator. Somehow we have to see what's happening before it happens. The delay in getting a test, the delay in getting the results of the test, only for symptomatic patients is just not good enough. And so when I heard of this program they were doing, I was very ecstatic. And maybe I trust the science more than others. I have a degree in biology, but I was looking for an early warning indicator. This made perfect sense. I was surprised that the detection had been able to detect remnants of RNA in a wastewater stream. I didn't realize that that's the level of detection accuracy they have these days. But nonetheless, it made perfect sense, and I was happy that it was going on. And if I will, I was actually out of town that day that I got notice that we had an increase. I don't know what the units are, but basically we were having about 1.5 units per day or something in this wastewater treatment, and it had climbed to over 10-fold higher in 3 or 4 days. And I got that notice, I think, at 1:30 or 2 o'clock in the afternoon, and by 4:30 I had put together what we call a reverse 911 call that we send out to residents for emergency messages, and we had it translated into Spanish. We sent out a message in Spanish saying, we've got an early indication that something's happening here and we need to step up our vigilance.
So what happened, Mayor Martin, after you put out that alert? How did your city respond?
Well, first of all, it wasn't just the 911, it got attention, such as the media picked it up and helped spread that message. I had been worried about people getting more lax anyway. But what we observed is that the advocate actually reported that we hadn't seen the increase that was expected in 7 days. But we did get an increase in about 10 days. We normally get about 5 new cases a day. It's about 3 cases per 100,000 or so. And it roughly doubled about 10 days later on a 7-day moving average. Now, that may be statistical noise, but it is sort of interesting that the wastewater predicts something and we see an increase about 10 days later. And interestingly enough, even as we were seeing the case increase, the wastewater numbers were coming back down again. So I believe, and I don't know that the timing is perfect, but I believe that the community took the message to heart. They became more vigilant. It helped drive that wastewater number down. And in fact, our cases dropped back down again, more to the levels that we'd had for the past 10 weeks, which is about 3, 4, 5 cases per day.
Jordan Peccia is still with us on Zoom, professor of environmental engineering at Yale University. Jordan, can you respond to what Mayor Martin shared with us? And when we think about this data being used to show that there are positive cases in an area, but not necessarily correlates with the fact that there may be an outbreak.
Yeah, that's right. This is sort of academic research that is going into application all at the same time. Typically in academia, we'd like to do this and ruminate on it for a few years, publish our papers, let peer review take their role, and answer all the questions and know everything about it. But of course, that doesn't work in the middle of a pandemic. And so we're learning on the fly. We have enough evidence to suggest this might work, that there may be a lead time. And, we're going through this. And every time there's a small outbreak, every time we see something in the data, that's a new data point for us to learn and to calibrate and to work out how accurate it's going to be and how much lead time information we can provide.
You can join our conversation here on Where We Live, the number 888-720-9677, or find us on Facebook and Twitter at Where We Live. Rob's calling in from Litchfield. Rob, what's your question?
Yes, hi, thanks. My question was, I heard or read some information, I think out of New York, that if someone has coronavirus and then uses a public toilet and flushes afterwards, it creates a plume in the bathroom. I'm curious if the speakers have any information on that, and more importantly, if so, how do we address it?
Good question. Dr. Albert Koh, could you take that one?
Sure. So many of these, many of the evidence that is being used to guide policy actually come from experiments. And I think the experiments that the caller is referring to is that we know that generating aerosols or generating plumes of droplets, where is a potential hazard. When you flush the toilet, you create these convection currents, and you can have spread of droplets within a closed indoor space. So that is a potential theoretical concern. We haven't really seen or had documented evidences of outbreaks, like outbreaks coming from public bathrooms. But this is certainly something that's on our mind. And given that the virus can survive or can be transmitted by droplets, what we call airborne droplets, which are actually fairly larger size droplets, and also the more recent evidence that actually there could be potential aerosol transmission. And that really underscores the importance of, how good ventilation, and not staying in for prolonged periods in indoor facilities, especially closed, cramped ones like bathrooms are. So that's certainly a concern that we all have. And I think, the big question is how much transmission is driven by that specific mechanism. Now, up to now, it seems like it's not major, but it's something that we're concerned about.
I keep thinking of my children going to school a couple days a week and, of course, using the bathroom in school. Not all schools have proper ventilation. So, Dr. Koh, the importance of continuing to wear masks and washing hands. Exactly,
Lucy. That, we do have a lot of evidence, and as you just mentioned, face masks are effective prevention methods for against the transmission of COVID. I think we heard several weeks ago the Dr. Redfield, the CDC director, saying that in perhaps a glib way, but that face masks are actually can be equivalent to vaccines in terms of how we can prevent and really keep ourselves safe.
You can join our conversation again if you have a question about both testing or just general questions about coronavirus and the upcoming months. The number 888-720-9677, or find us on Facebook and Twitter at Where We Live. Mayor Martin, I wanted to go back to you. I remember talking with you a few months ago, right after the peak, and you talked about why it was important for your city to proactively go to particular parts of Stamford to test near apartments because people are living in close proximity. You didn't want to wait until someone showed up at a hospital and was sick. And so I'm wondering, when you think about the costs for this individual testing versus participating in this wastewater testing program, there must be some financial benefits as well.
Well, to me, they are two different complementary programs. The early warning that we can learn and basically if the community is getting out of control, then I know ahead of time and we can react to it, or in this case, I think we help push it back. Mm-hmm. But the other one is something that I don't know whether it was Albert or Jordan already said, is that it isn't just high density, it mm-hmm. is different socioeconomic status, their inability to get traditional health care, or at least historically they haven't gotten health care. And what we started doing is once we got an agreement with the hospital to share the testing data, we could find the exact address of the person, and then we knew where these cases were occurring. And what we observed is that in the poor neighborhoods in high-rise buildings, we had a lot of cases. And it wasn't every place, it was here and there. And so we would go with our testing and we would go to that location rather, trying to get people to say, well, call your primary care physician and then schedule an appointment and then drive over here and then wait in line. We went to their location and said, we'll get you insurance. We can't get you insurance. We'll give you a test anyway. And we actually would go door to door, knocking on the doors of the people living in these apartment buildings and say, come down, the testing is across the street. And we tested, thousands of people using this mechanism. And that evolved. It evolved to, we were working with our churches. We were working with the NAACP. We were working with Building One Community, which serves the immigrant community, and saying, you know how to reach out to your community, and I think they would trust you to come in and get a test. And we ran thousands of tests through that to reach out to communities that typically didn't avail themselves of healthcare, give them tests, and sure enough, we were finding both symptomatic and asymptomatic cases of COVID among these tests. And I think it helped their health and it helped the community, because by identifying those potential people who might be spreading the disease and getting them the proper medical care and getting them into quarantine, it protects the community as well. It is in my opinion, it is a huge benefit to the community, both health and, interestingly enough, as you said, economically.
You're hearing Stamford Mayor David Martin. Also with us is Jordan Peccia, professor of environmental engineering at Yale University, as we talk about this wastewater testing program. Jordan, when we think about these wastewater treatment plants serving hundreds of thousands of people in a region or area, what about particular outbreaks that we hear about, whether it's at near the University of Connecticut or at nursing homes, particularly the Norwich case that was really troubling? Those are much smaller areas, and so can something like this be used in those situations?
Yeah, there are different population levels in which you could apply this type of technology. And I would mention that, we started sampling Norwich towards the middle to end of that nursing home outbreak, and we absolutely saw that outbreak in the wastewater. But we're sampling right now wastewater treatment facilities in cities, and they range from population served about 20,000 to over 400,000 people. Overall, it's capturing about 1 million people in Connecticut. And we've chosen to do that to get, the biggest bang for the buck in this case, and to be able to capture the most cases potentially. But there are many other applications that can be useful. So, for example, you can sample sewers as they lead from nursing homes or dormitories. And in that case, the data analysis is very simple. It's either positive or it's negative. If it's negative, good. If it's positive, you're in trouble. And you need to go back and do some testing. You can move it up to a larger area. You could capture just one section of a city if you had a specific concern about that area of a city or a neighborhood by isolating and sampling from sewers that are serving that section of a city. So it can be adjusted for anywhere from something like 500 people to 500,000 people.
I mentioned UConn. Joining us now on the phone is Dr. Kendra Moss, who is a researcher at UConn. Kendra, welcome to our show.
Thanks for having me.
So I understand that you have been looking at wastewater data for UConn's community. Can you tell us what you've been doing and what you've observed?
Yeah, so when Jordan's preprint came out in late April or early May, I really wanted to apply that to UConn. And I contacted him, and basically the way that our wastewater treatment facility is we simply don't have the same type of sample as a large facility has. So I had to kind of revisit methods and work with raw sewage. That actually enables me to test the wastewater treatment plant and just sewer pipes with the same method. So that's what I've been doing. We started collecting samples in late June from the wastewater treatment plant, and then have been putting in composite sampler pumps around campus since then.
So tell us how the university... Go ahead, Kendra.
Oh, sorry. I was just going to say, where Jordan was saying that you need to really worry when you find a signal from a particular dorm, we actually find low-level signals from all of our locations. And I think it just has to do with the length of time that people continue to shed the virus at low levels after they've recovered. So we are, like Jordan, we're looking at trends. We're looking to see if it's increasing.
And how have university officials responded to this data when, again, in the news we hear about particular dorms having to quarantine and cases rising?
Yeah, so I wasn't given the go-ahead to do this until I got someone who would respond to the data. And that has been the Student Health and Wellness on campus, the Student Health Center. So I give this data to Student Health Center. We share it with the executive team daily. And the student, SHA, the Student Health and Wellness, takes that data and helps to direct their surveillance testing. So if I start to see an increase in a particular cluster of buildings, SHA will then the next day or a few days do more of their surveillance there rather than completely random.
That's really interesting. Kendra, I apologize if I said your last name incorrectly. Can you say it for us?
No, you got it right.
Oh, okay. I just wanted to double check. Well, thank you for telling us about what you're doing at UConn. It's definitely interesting and ties in well with what we're talking about. Dr. Albert Coe, who's with us on Zoom, can you talk more? Again, you continue to advise Governor Lamont, and I'm wondering how this type of program can be replicated in other situations. I know I mentioned UConn and some of the outbreaks there, but when we think about our prison population, I'm just wondering, are there other conversations happening to make sure this is being done in other places beyond just the large cities?
So, Lucy, let me just pick up on what Mayor Martin said, and actually he actually read the playbook on sound public health practice about really what needs to be done. I think there are two basic messages that underscore that. One is that the most effective responses are those that are going to be done proactively, that are going to be done before large outbreaks, whether they're in nursing home, prisons, or in the community happen, rather than reactively. And then the second factor that underlies all of that, and I think the example of the alerts, whether they're, what the mayor had declared for Stamford, or what Commissioner Gifford declared for, and the Department of Public Health declared for Danbury in their ongoing outbreak, is that by giving these alerts, probably what we found throughout the epidemic here in the United States is that probably the most important preventive mechanisms are the behavioral changes that people do by themselves. The work done by our citizens in maintaining social distancing using face masks. So that's a really important lever, to get out public awareness. And I think the example of wastewater surveillance that Jordan has developed is a good example of how to do that. I think Dr. Kendra Moss, really also, highlighted the real need to tie this wastewater surveillance with good outbreak investigations so we can validate. She mentioned that there are low-level signals. We know that the virus RNA, or the virus, can persist for extended times in people who have been infected. So we really need to do a better job of understanding what's signal and what's noise. And by doing those really granular, intensive outbreak investigations together, using this new toolbox of wastewater surveillance, we can certainly see how it's going to work, whether it's on a neighborhood block, whether it's in a prison, whether it's in a nursing home. And I think that's the future work that needs to be done, really tying together what we call the epidemiology, the study of disease causation, together with these kind of new technological tools. That's future work, and there's more work ahead for us to do. And I think this highlights kind of the unique aspect of the state of how we have a really close link between government, public health, and researchers such as Jordan.
Jordan Peccia, I have a question for you from Twitter. Someone wrote, the Greater New Haven Water Pollution Control Authority receives sewage directly from 4 different municipalities, ranging from suburban to semi-rural, and has sludge importation contracts with dozens of other municipalities around the state. How would one geographically pinpoint an outbreak from this data?
We would not. So, be able to geographically pinpoint it, other than say the outbreak would be within those 200,000 people that are served. But what I would say about that is that the municipalities are New Haven, Hamden, East Haven, and parts of Woodbridge. The importation of sludge is a different situation. It's a fine distinction, but sludge is not always sludge. And so we're sampling primary sludge. This is the sludge that comes from that first sedimentation step in a treatment plant. Other treatment plants around the state do make sludge as well, but they import it into the treatment plant in New Haven, and that goes into an incinerator. We don't see any of that sludge.
Well, thank you for answering that, Jordan Peccia. It's been really interesting talking with you, Professor of Environmental Engineering at Yale University. Thank you for your time today on Where We Live.
My pleasure, Lucy.
Dr. Albert Coe is going to stay with us again. He's an advisor to Governor Lamont on Connecticut's COVID-19 response, and he's a professor at Yale School of Public Health. And Stamford Mayor David Martin will be here, too, to continue talking about how municipalities and leaders are thinking about a potential surge in the next few months. You can join us, too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. With us today on Zoom, David Martin, Mayor of Stamford, Connecticut, and Albert Coe, Department Chair and Professor of Epidemiology at Yale School of Public Health. I wanted to ask both of you about fatigue. We've all been through a lot, and having to quarantine, dealing with shutdowns, trying to figure out this new balance of whether you continue to work remotely or you still have to go into work, and taking precautions, worried about our kids. I wanted to start with you, Mayor Martin. Are you seeing fatigue in your community? And when we hear that it might get worse again in our state, how do you help your residents continue to take the precautions necessary?
Lucy, I'm fatigued. I'm tired of this.
You and me both.
We're all tired of this. But nonetheless, the disease is out there. And I'm promoting wearing masks. I try to be an example in wearing masks, and occasionally I get out of the car and forget and have to run back. But this fatigue turns into what I call a lack of vigilance. And we're balancing it with the need to educate kids in our schools. And how do we keep it safe, and what do we do? And we're balancing it with the economic viability of our restaurants and our retail stores. And I won't pretend that this isn't a challenge. I believe that for the most part, the state under Governor Lamont and others have gotten it right. We were working on our own reopening guidelines, and for the most part, we had something very similar to what the state did. The state, might have been a little bit more strict or a little bit less, pretty close to what we were thinking, and had caught some things that we had missed, so that was good. I would tell you that right now, though, I'm concerned about some of our restaurants. And in fact, I'm having a letter go out to all the restaurants, and we are stepping up our ability to enforce. And we have a simple system. We'll give you a verbal warning. We're coming back in 24 to 48 hours. You get a fine, and we're coming back in 24 to 48 hours. And if you're still there, we're shutting you down. We don't have time to mess around with this. And for the most part, the restaurants are fine. But when one or two or three start, sort of pushing the envelope too much, and then everybody else starts pushing the envelope because that seems to be okay with everyone, and then the original people push it more, then you've got this lax behavior that gives rise to cases. And to this point about the wastewater, I'm looking at the chart right here, right now, and it's not as high as it was right at the end of August versus September, but it's beginning to drift up again. And I can go out and see some of the behavior that's going on in the restaurants, and I'm saying this is not good. So we're working on that in terms of communicating to them and setting up enforcement that we will be kicking off here in the next few days.
So when you talk about the restaurants specifically, Mayor Martin, are you saying that some establishments may not be wearing their masks or not taking the capacity restrictions seriously?
Well, for instance, I've seen something on social media about a particular retail store, and people are complaining because they go in and the employees there are wearing their masks around their chin, not around their nose and whatnot. And it's going to cost them business because it's spreading on social media. But I've got to send somebody up there and say, guys, this isn't right. On the restaurants, what I'm observing is the tables are spaced appropriately apart. And those tables could seat 3 or 4, maybe 5 in some cases. But late at night, on a Thursday, Friday night, or a Saturday night, when we typically don't have our health people going around, they don't have 3, 4, or 5. They've got 14 people spread around that table. And it's almost like it's just one big happy party from one table to another. And I've got to do some enforcement and reset the expectations. That's not acceptable.
Albert Coe, I'm wondering if you could respond to what Mayor Martin shared and how you and others within Governor Lamont's team are advising municipalities who are seeing different behaviors popping up.
Yeah, so I think when the mayor said, or Mayor Martin said that that he was fatigued, I think that resonated with all of us. All of our population, our fellow citizens, neighborhoods, have went through a lot, over the last 6-7 months. And I would also add that, in addition to the kind of fatigue on the personal side, this has had a real impact on the livelihood and the economy, and really for our vulnerable communities who are most at risk for suffering from the reduced, the reduced social distancing preventive mechanisms that we've had, such as the restaurant business and the service industry. But that underlies the score. And I think we just have to look at the lessons learned, when we look at Europe or when we look at the rest of the United States, where they got hit hard like we did, but they opened up quickly. And we could see resurgences and pretty severe resurgences. Europe, France, Italy, United Kingdom, Spain, they're all going through major resurgences, perhaps as bad as their initial one. And that really underscores the importance of many of the things that the mayor was saying, and that the governor's office have been, promoting is that we need to maintain that social distancing and the face mask use. That's what's protecting us at this moment. And that, and this is where fatigue and erosion of those kind of practices are really quite dangerous, especially as we're going into the winter season. If we're going to safely keep our schools open, we're going to have to push, the levers on the sound practices, whether it's social distancing, face mask use, through guidances, rules and regulations, as well as, communication campaigns. And this has been, I think the priority of the governor's office and the Department of Public Health in really underscoring the importance of these sound public health practices and working with cities such as Stamford in implementing these.
I want to thank Stamford Mayor David Martin for joining us here on Where We Live. Albert Coe, we just have a couple of minutes left. I wanted to ask you, just looking forward, you mentioned it's important for residents to continue social distancing, continue wearing masks. But when it comes to the cold weather, flu season is around the corner. I wonder if you could just tell us some final thoughts about other things we should be thinking about as it gets colder.
Yeah, we're really concerned, of course, as much of the country is, about the upcoming winter season. First of all, because when you spend more time indoors, there's more increased risk, especially in congregate settings where there are multiple, many people in a gathering, for transmission. The second thing is that if we have concomitant parallel epidemics of COVID and influenza, that's certainly a threat to our hospital system and healthcare systems, and having hospitals go into surge crisis. That underscores how ever more critical it is to really keep up the good work that that the citizens of Connecticut have been doing with respect to social distancing, with respect to face mask use, whether indoors or outdoors. I think this is unfortunately the proverbial new normal for us for quite a while. Even we're hoping that an effective and safe vaccine is going to be developed, but it's going to take at least a year to get that to our general population. And it's not even clear that that vaccine may help us reduce deaths and hospitalizations, but it may not necessarily prevent or block transmission. And so we're really going to have to get it right in terms of, of all the behavioral interventions, having people do sound social distancing and face mask use for months to come, especially helping us get through the winter season.
Dr. Coe, not everyone was pleased to hear that the governor signed an executive order where people could be fined if they don't wear face masks. But is this an effort to combat that fatigue that we were talking about, where people become lax?
Yeah, exactly. And we know that, in public health, you have to kind of push out all the stops. One is promoting and really looking at shining examples, and many of the kind of the policies, sound evidence-based policies that Mayor Martin is implementing in Stamford. But we also have to be clear that, key issues like wearing face masks, like quarantine, isolation, those things that protect the public in general, that they are enforced.
Well, thank you, Dr. Albert Coe. We're almost out of time, but we so appreciate your time today on Where We Live. Thank you.
Thank you very much, Lucy. This is a great pleasure.
Today's show produced by Carmen Baskoff. I'm Lucy Nalpathanchel. Thanks for listening.